Good morning.
Good morning.
Thank you again for agreeing to do this interview. I'll go ahead and say this is our second run. The first time there was some audio issues, so I thank you for the first interview, and I thank you even more for accommodating this second interview.
Sure.
So for starters, do I have your permission to record this interview?
Yes.
Okay. So I'll introduce myself first. I am Bianca Darrington. I've been working at MD Anderson for about 6 years. The first 5 years was in the ICU, and then I finished nurse practitioner school. So I currently work as a nurse practitioner in diagnostic imaging. Also, this semester I started my doctorate of nursing program at Prairie View A&M University, and one of my first classes is called Emerging Technologies. In that class, we explore different technologies in the healthcare field, and then we choose one to go a little deeper on as far as interviewing someone who kind of works in the area and doing a timeline. So the topic I chose, of course, was 3D printing. And after doing some research on MD Anderson's website and reading an article about you in the Houstonia magazine, I decided to reach out to interview you. So again, thank you so much.
Thank you.
You can introduce yourself.
Sure. My name is Justin Bird. I'm an orthopedic oncologist and a spine surgeon at MD Anderson. I'm also the director of our innovation program for the Division of Surgery.
Okay. Could you tell us more about a particular notable project that you have achieved during your career?
Sure. So, in my practice, I take care of complex spine and pelvic tumors primarily. I also work on some extremity tumors, and I really have started to use these technologies, image guidance, 3D printing, custom implants. All of those have really become very helpful now for the reconstruction of the skeleton after we remove the tumor.
Mm-hmm.
And so I have a number of cases that I've done in this area, and using these models has been very helpful.
Okay. Do you care to tell us a little bit about the story? There's like a young lady, I think she was like 27, and with the knee.
Yeah, so that was a very interesting case. A really nice young lady who developed a osteosarcoma, a cancer of bone,
Mm-hmm.
behind the back of her femur, close to her knee. And the issues there when we remove the tumor, it's so close to the knee that typically in the past we would do a knee replacement, a very complex knee replacement, and that limits the person's function when we put in metal and plastic parts to replace a joint. With technology, 3D printing, I was able to come up with a surgical plan, and using 3D printing materials to create cutting guides that allow me to get very close to the joint without disrupting the joint.
Mm-hmm.
And so I could take the tumor out, not get into the actual tumor, which we don't like to do, and save the knee joint. And then we were able to replace the bone that was removed with a piece of allograft, cadaver bone. All of this was done using these 3D printed cutting guides and using 3D models.
That's amazing. That is amazing. So I'm actually working on a timeline for 3D printing as well. So I just want to ask you, do you recall around the first year that you heard the term 3D printing?
You know, it's hard for me to remember when I first heard the term, and I do remember being fascinated by the idea as I started to hear, and I think I heard it on the news, discussing this idea of 3D printing and being able to layer, rather than just printing on a flat piece of paper, but being able to layer materials on top of each other so you make a three-dimensional structure. And I remember hearing about that and saying, wow, that's really cool.
Mm-hmm.
But it was a long time between that introduction and thinking about how I would be able to use it in medicine and surgery. It was years before I started really think about the applications and how it could impact patient care.
Yes. Yes. So actually, I want to share something that I learned. There's a guy named Charles Hull, and he actually submitted the first patent for an apparatus to print 3D printed models in like 1984. 1999 was the first ever 3D organ. It was a bladder. And then in 2002 was the first miniature kidney created, and it could filter blood and produce dilute urine in animals. So, has come a long way. It's to say that right now we're, actually really saving people's lives, and, even looking into organs, 3D printing organs. Um, did you know that orthopedic implants is one of the top three productions in 3D printing?
No, I wasn't aware. I think in our field we are seeing we're definitely seeing the increased use of it. Um, uh, and I've also looked at how other industries are using 3D printing in aerospace engineering and in manufacturing cars and things like that. There's so many other industries that are using it, but it's interesting to know that orthopedics
Yeah.
is one of the fields that's using it a lot.
Right, and that was just a coincidence that you work in orthopedic oncology. I just liked the article that I read about you, but it made it even better to know that you're actually working in one of the top three areas that is utilizing 3D printing. So it's also personalized surgery, prints, and then dental. Of course, dental uses a lot of 3D printing. So the market right now for 3D printing is estimated at about 1.25 billion, but it's expected to grow to 6 billion in the next 5 years. So they have a lot of, things in the works. In your opinion, what are some of the advantages of 3D printing in the medical sector?
Well, I think particularly for orthopedic oncology, every tumor is different. So the 3D models, what I learned very early on, when we make a model, that makes it very easy for people to understand the anatomy. And this is complex anatomy. So when you look at a MRI scan and a CT scan, it takes years to understand the details of what you're really looking at. And that's part of our training programs when we see residents and fellows come through. And we're trying to teach them what I've learned over decades. The model, it allows people to put that anatomy in their hands and spin it around, and it makes it very easy to understand. And that then translates into a better appreciation of the surgeries that our trainees are watching and learning. It translates into a better appreciation from the patients of what cancer they have, what anatomic structures are involved, and what they may be going through during the surgical process and the rehabilitation process. It translates into better communication between the surgical team members. Many of the surgeries I do, there are multiple surgeons, orthopedic surgeons, plastic surgeons, thoracic surgeons, vascular surgeons. We have a long list of team members that we pull into these surgeries to help us. And they're not used to always looking at a spine MRI, as I have been trained to do. But when I hand them a model, now it's easy for them to understand without going through years of training and to understand these complex imaging modalities. So I think those are some of the things that we are using right now and have been very helpful with these 3D printed models.
That is fascinating. That is truly fascinating. So there's a lot of talk about 3D printed organs coming within the next 5 to 7 years. What are your thoughts on that?
So I'm excited to get into the 3D printing of biological tissues. I think that's something that is going to, again, change our practice, improve care. I think, there's great opportunities, even in orthopedics, in printing bone, in printing soft tissue attachments. Those are things that we still have some gaps and still need to find better solutions. We use in orthopedic oncology, we use a lot of allografts, so which are coming from cadaver sources, but there are some issues with healing and things of that nature, and so so the 3D printing of these biologic tissues, I think, would be really helpful in terms of organs outside of the musculoskeletal system. Printing kidneys and other organs, I think, is very interesting to think about. I know one of our colleagues in orthopedics, Dr. Lorenzen, Cato Lorenzen's a very world-renowned orthopedic surgeon and researcher, MD, PhD, and he has a regenerative medicine lab and has been working on these materials and regenerating these materials, and 3D printing is a big part of regenerating tissues in the musculoskeletal system.
Yes, sir. Let's see. Are you aware of any ethical issues with 3D printing?
Well, I think anytime you're creating organs, there is an ethical consideration, right? So you need to think about what does the technology enable us to do, and then what are the ramifications of that, and so a lot of times when you start to talk about children, when you talk about fetuses, are we ever going to get to a point where we can identify maybe organ defects in a small child or even a fetus, and we 3D print an organ, and that's then used, implanted, and then used as the child grows. So these are all very potentially useful applications, but we also just need to be thoughtful about it and consider what are those ramifications and what are the ethics and involved. And that's something that we should be doing for all of the applications that we are pursuing, and this is just another I think part of that.
I agree. If I wanted to know more information about 3D printing, where else would you recommend me go?
Yes, I'm really excited because I've been fortunate to work with our 3D printing folks here at MD Anderson. We have a 3D printing lab that's run by Dr. Elsa Arribas, Dr. Lumeri Santiago, and they just brought on a biomedical engineer, Karthik Thapa, and they have been developing our 3D printing lab and our capabilities. And so it's really exciting to be able to work with them and help develop this program. So I would definitely reach out to them, and they could give you even more information on the process.
I will. Okay, and I'm actually familiar with both of those. They both work with breast.
Yes.
Yes. I do. Again, I work in diagnostic imaging, so I protocol some of the breast CT and MRI, and their names come up a lot.
Yes.
Okay, so lastly, I see you have a few models around your office. Do you mind showing and explaining a few of them to us?
Yeah, sure. So I'll just bring you over here. So these are a couple models. You referred to that article that was in the Houstonia, and this is one of the examples that was shown there. This is the tumor. This is a model using plastic 3D printed, and this shows the osteosarcoma that was on the back of the femur. This is the femur here, and this would be the knee joint at this end. And so the model of the tumor, and then this is a model showing what the surgery would look like after the tumor was removed. And you can see that we left a small sliver of bone on the front of the femur, and it gets very close to the knee joint. And then the reconstruction was putting a allograft cadaver bone into that defect and fixing that. So that's one of the models.
That's amazing.
This is a very extensive model, and this is a personalized model, life size. And the interesting thing about this model is that it comes with different materials were used to make this model. And so you can see this is the thorax, cervical spine, thoracic spine, and this is the tumor here. But we also modeled, the soft tissue, so lungs that can actually be inflated through these tubes, the heart. And so the reason we did all this, because this was a very unique tumor in a challenging position, and I needed to disconnect the spine in the cervical and thoracic area, both in the front and in the back, so that we could take out this tumor all in one piece. For sarcomas like this, we don't like to take them out piece by piece. They need to come out all in one piece, and that gives us the best chance of preventing this from coming back. But in this location, cutting the bone in these areas is very challenging. They're very important and critical structures that run through this area.
Yes.
The vertebral artery, major vessels, the nerve roots are coming out from the neck and coming down and become the brachial plexus. And then you have the rib cage. So we have to understand, how do we access these areas so we can cut the bone. And this model was helpful because I was able to take the tools that I have and try them out and see if they can actually reach into the space from various approaches. And so that is very helpful, because then I know that this tool works, this one doesn't. So then it starts to help me modify the plan so that I know that I can execute that plan when I get into surgery. And I'm not learning those things during the surgery.
Exactly.
I've already tried, I've already practiced the surgery using the model, and now those things are known factors, and then I can adjust, and then I can help my team members understand what kind of things we need to get the surgery done.
Yes. Well,
need
thank
any
you.
more, or-
No, that was
Okay.
really good. That was really good. I remember the last time you showed me something else, and you had two,
Yeah.
and I like how. Oh, well, you didn't have two, but sure.
Oh, I'll
I
quickly.
like how it was. Yeah, I like how there was, the one with the tumor, and then you have the
Yes.
other without.
Yeah. So the other thing we can do is we can do make a model that shows the tumor, and then after the tumor has been removed, what should it look like? And
Yes.
so this is the model
Amazing.
with what we call, these are fibulas, fibula struts. We take the fibula from the person's leg, we bring it up into the defect after the tumor has been removed, and we're using that fibula to rebuild the junction between the lumbar spine and the pelvis.
Okay. And then, just because you didn't go in as deep on this one, I'll point it out. This
Sure.
is the tumor.
Correct.
And
yeah.
it's basically, those are the same models, but
Yes.
that one just has the tumor in, and this is the model without.
Correct.
That is absolutely amazing. Again, I work in diagnostic imaging, so I am a visual person. I do like things. I like, pretty much, I wouldn't be surprised if I got into 3D printing in a few years. But thank you so much. I truly appreciate you.
You're welcome.
Thank you.